Uh, okay, welcome back to our program Elixir of Life, and now we are coming to the most important, which is episode theme is obesity and plastic surgery. Our distinguished guest today is Dr. Ghazi AlThubaiti. He is a consultant plastic surgeon from King Fahd Medical City. Welcome, Dr. Ghazi.
Thank you very much, and I'd like to thank all of your team for having me today.
Okay, it's a great pleasure and honor for us. Just without further delay, we will go to the topic. So starting by to discuss, is obesity a real medical problem in Saudi Arabia?
Yes, obesity is a real medical problem, and it's in the rise in the last several years. A great percentage of our population, up to 70% or even higher than that, are either obese or overweight. Now, obesity and overweight conditions are associated with other medical problems such as ischemic heart disease and diabetes. And those in the future will cause even further trouble to our health.
Yeah, I mean, because we pointed out to obesity and overweight, is there any difference? And what's the ideal body weight? Okay.
Well, we use something called body mass index, in which you have to calculate your body mass index, which is your weight in kilograms divided by your height in meters twice.
Square, yes.
Yes. So the number should be ideally between 20 to 25. This is the ideal number for having a normal body mass index. Now, if you go a little bit higher than 25, between 25 and 30, that's overweight. If you go a little bit higher, that's the first degree of obesity. And then a little bit higher, 5 degrees higher, that's the second degree, and then you go to the morbid obesity. And most of our, I would say maybe 30% at least of our population are overweight, plus the other 30% which are obese probably.
What's the cutoff of morbid obesity, or we call it super obese? Is there any cutoff 40 or say 35?
Well, obesity itself could be associated with medical problems, even with lower body mass index.
Okay.
So that term has been used when you go to the higher body mass index. But recently, or in the last few decades, we've seen patients in Saudi Arabia with a body mass index of just above 30, and they're becoming diabetic and starting to have ischemic heart disease, which calls for intervention.
Excellent. We often times hear about obesity or types of obesity. We have central obesity, like a pig belly, and you have generalized obesity. Can you enlighten us about this important?
You have to go back to the roots of obesity. Many patients or many people are obese because of many factors. Most of the factors are the diet and lack of exercise, but one major factor is heritage. Some people tend to have fat located mostly in some specific parts in their bodies, such as the thighs, the stomach, or the back, or arms. And that give you different types of fat accumulation or obesity. The one that's associated mostly with medical problems, diabetes and ischemic heart disease, is the truncal obesity. Once the fat accumulates around the stomach, inside the abdomen, inside the stomach, then the patients start to develop what's called insulin resistance, and eventually will become diabetic over time.
Excellent. Can we just talk more to explain to our, dear viewers, the anatomy of if somebody having pig belly? Where is the fat? Is it inside the abdomen? Is it below the skin? Is there any difference between we call it subcutaneous fat, just below the skin, or a fat inside the belly, we call it visceral fat? Can you just, if you
Yes, if we can come here, if you can focus on this.
Yes, okay, we'll focus.
Let's first start with this, with the normal, with this one.
Sure, okay, excellent.
So this is a cut section in which this is the back, this is the front.
Excellent, yes.
Okay, now if you zoom in here, you'll see that this is the skin, and this is the fat, the yellow layer, and then this is the abdominal wall.
Okay, the muscle.
And whatever inside, let's call it just the stomach.
Stomach, excellent.
Now this fat is outside your stomach.
Excellent.
Okay, now there's other type of fat that's located inside your stomach. If you remove the abdominal wall, this is the abdominal wall. This is removing the skin and the fat. What you see here, the white stuff, This is a membrane that covers your muscle. We call it the fascia.
Excellent.
Now, if you remove all of this, you remove the muscles and everything, you'll end up inside the abdomen.
Okay.
So this is inside the abdominal
Yes.
cavity.
Okay,
This is inside your stomach. Now,
Yes.
this fat, I don't know if I can remove this fat.
that cannot be removed. Fixed.
Yeah.
Okay.
So this fat is called the omental fat. This is the fat inside the abdomen, located between the bowels, the liver, and all the vital structures inside there. This is also critically important because this is also associated with medical problems.
Excellent.
Now, plastic surgery cannot get rid of this.
Okay.
This is one of
Great.
the major things that you should know.
Oh, very
Plastic
interesting.
surgery can get rid of this fat that's located outside only.
The blue skin. Yes.
Yes.
And what about the fat inside the liver? Because we have the fat in the omentum, the visceral fat, and we have inside the, in the liver, we call it fatty liver disease,
Yes.
or it will be in the colon or small bowel. Okay, so that's
That's a little bit outside the boundaries of my specialty, but having fat inside the liver accumulate to an extensive degree is actually, as you mentioned, fatty liver, which is a medical condition. It's not
Excellent.
actually normal to have an extensive amount of fat in the liver.
yes, be good surgeon is a good physician as well.
Yeah,
Excellent. That's, I think, just because we're talking about the risk of central obesity, I think that's the most important, according to recent research, is the visceral fat in the liver and in the omentum and around the bowel. So just this leading us to the next important topic. What are the commonest abnormal fat distribution? Because we do often hear about pear
Well,
or
people like to describe them according to the look, the way
Excellent.
they look. They call it apple look if the fat is mostly around the stomach, and the waist to hip ratio is reversed, in which
Okay.
the waist is bigger, which means your stomach is much bigger than your hips.
Excellent.
There's a certain percentage that's normally about 0.9. If that's reversed, it means that you have too much fat around your stomach, and your stomach is actually bigger than your hip. Now, there's also another type of obesity in which fat will accumulate around the thighs and the hips in the lower part of the abdomen. We tend to see this in females. Well, some females, they have the reversal of that. Some females will have fat deposited in the trunk, which means the back and the chest, while they have, excuse me, less fat around the thighs and the lower part of the body, which gives them a
Reverse
man
triangle.
look.
Or reverse
We call it,
triangle.
android look,
Android.
in
Okay.
which they look like a man. So that's because the fat was placed in locations that it's not expected to be there.
Very, very interesting indeed. And this leading us to important topic, bariatric surgery. It's now a fashion. It's a trend. What are the indications of bariatric surgery?
Well, me myself, I'm a plastic surgeon. I wouldn't speak for them, but generally, this
Briefly,
is,
okay.
Yes, this generally the bariatric surgery aims to treat those patients with significant obesity that could not be treated medically or by diet or exercise.
Excellent.
Now, I have a few of my colleagues talking about expanding the indications for surgery, which means surgery now is being offered to patients with lower body mass index, which means it's being offered to patients who are less obese just because they start to develop medical problems such as diabetes. Now, excuse me, it has been proven that some types of bariatric surgery will actually help to cure or stop or minimize the effect of diabetes. And that has been shown in some of the patients I actually witnessed. Some patients actually were on insulin, obese patients on insulin. They have significant insulin resistance. And once they go through bariatric surgery and they lose a certain amount of weight and keep it and modify their diet, exercise, and lifestyle, their diabetes is basically cured for the time being. We don't know what's going to happen in the long term, but it seems that this method of treatment has been effective now, which expanded the indications for bariatric surgery.
Excellent. I think that's important because we know diabetes mellitus is a chronic disease, but only certain occasions, like after bariatric surgery, I have seen myself patient cured. They were receiving insulin injections tablet, and they've been cured. That's really a magic therapy, only situation that we can cure diabetes. Now we more coming to the main business, which is what's the difference between bariatric surgery and plastic surgery?
Okay, there's a striking difference between those two specialties.
Okay.
Bariatric surgery is a kind of surgery that aims to treat obesity. Okay. Plastic surgery is designed to help those who are not obese anymore. They lost their obesity, and now they have consequences of losing the weight. Consequences of losing the weight includes skin redundancy, and sometimes what we call lipodystrophy, which means fat abnormal deposition. Fat is located in abnormal places. Those patients who are not obese, they could be helped by plastic surgery, which will help them to recover and regain the normal look or a near normal look of their bodies after surgery. Because so many changes happen after significant weight loss after bariatric surgery. And we could go through that if you want.
Yeah, how the person knows he's a candidate of bariatric surgery?
Well, my advice first is to seek medical attention, to go to bariatric medicine or bariatric surgeon or a dietitian in the beginning. Get assessed and see why they're obese. There are many reasons for people to be obese. There are many etiologies, I would say, for obesity. Once the doctor diagnoses obesity and rules out medical conditions that led to obesity, such as thyroid problems, etc., then the patient will be offered medical treatment. And if medical treatment did not work and diet and exercise did not work, probably they should seek an opinion of a bariatric surgeon who will probably discuss with them the options from bariatric surgery standpoint.
I think the same question, how the person knows he's a candidate of plastic surgery after bariatric surgery.
Okay, so let's assume that somebody underwent bariatric surgery and their weight was 130 kilograms and then they lost weight. Now, if they come to my clinic, the first thing we talk about is how stable is the weight loss. They tend to lose weight till they normalize, almost normalize the body mass index. And then I want them to stay within that normal range for at least 4 to 6 months, which tells you that yes, they lost weight and they managed to successfully keep that weight off. They did not go back to obesity. And then the second thing that comes with losing the weight, some patients, they will lose also vitamins and minerals, and their general medical condition deteriorates during the process of weight loss, and that has to be corrected before surgery. Once the patient has a stable weight for several months and their medical condition permits doing any surgery, they have to be assessed by the plastic surgeon. Now the assessment is from tip to toe. They have to be examined thoroughly. We'll assess the areas that might benefit from plastic surgery, and then the options will be discussed with the patient.
Good. Okay, is it true that bariatric surgery has limited short-term benefit?
This I wouldn't go into discussion that. I think if it was planned well and the patient is motivated and supported, there will be, I would expect success. And I've seen so many examples in which morbidly obese patients became bodybuilders, and they managed to successfully keep themselves away from obesity for several years. So it can be really a life-changing event given the circumstances to maintain the success are there. So I wouldn't say it has a short-term effect, because I think it has to do mostly with the patient motivation, diet and exercise, and all of the other supporting parts of the treatment.
Yeah, because we have misconception that patient after undergoing bariatric surgery, they don't follow diet, they don't follow exercise, and might have failure. Okay, so
well, that's a problem. Then you probably should not go for surgery if you're not willing to what's after surgery, because you're wasting your money if you're going to pay X amount of money to have your bariatric surgeon remove part of your stomach, and then you end up eating a lot, and then, you know, body tends to be able to recreate its previous shape. I mean, the stomach could actually expand, and you could start regaining your weight, and then you're back to where you started in the beginning. So I think it's very important. Actually, even the bariatric surgeons are very selective when they choose the patients.
Okay. Thank you, Dr. Ghazi. Now we'll go for a brief report and we'll come back. Please stay tuned.
So who is it that qualifies for weight loss surgery? And part of this, and what somebody's body mass index number indicates, is who is it that is going to stand to benefit most from undergoing the risks of surgery? And that's typically our class 2 and class 3 patients with obesity. That's because the health risks that are associated with that body mass index are significantly more, obviously, than somebody with a smaller body mass index. To understand obesity, we have to understand it is a complex multifactorial disease. There are genetic components to obesity, environmental components, behavioral components, psychological and physiological components, and also metabolic components. And any kind of treatment strategy for obesity has to be able to address each and every one of these. The benefits are not just the number on the scale that changes as far as the weight loss, but the health problems that are improved as well. And over 96% of those health problems related to obesity are completely resolved and reversed, usually within days to months after surgery. So there are profound physical and emotional benefits. Kind of going through some of these, well, depression, there's a 47% reduction in depression, 46% improvement in migraine headaches, 25 to 66% control of diabetes, 42 to 66% resolution of high blood pressure, 37% of something called non-alcoholic fatty liver disease, or hepatosteatosis. This is where the body stores fat in various organs, one of which is the liver, so we have improvement with that. There's improvement in arthritis, 41%, 50% resolution of stress incontinence, 39% improvement in asthma, 45 to 76% resolution of sleep apnea. So significant improvements in patients' overall health.
Welcome back, our dear viewers, to Elixir of Life with Dr. Al-Sheef and our guest, Dr. Ghazi AlThubaiti. Welcome back.
Thank you.
We'll just continue the interesting discussion about what are the plastic surgical options for a patient who lost a lot of weight after bariatric surgery. I think this is a very important question. Maybe the
Yes, this is a very important question, and many people ask this. And let's say somebody, as we mentioned earlier, has had a weight of 130 kilograms and then had bariatric surgery.
Sometimes we have 230. Okay.
I think 130 is good enough, maybe, for my example. So when we assess those patients, say they lost the weight and now they're stable, after 6 months of having stable weight, I'm not talking about the surgery, it might be like 1 or 2 years after surgery, those patients has to be assessed. We usually start by assessing the head and neck, the face, part of the neck, to see if there's any extra skin. Some people have some hollowness inside the face. They used to have full face and now it's too thin. Then after that we'll look at the chest for men and women, both. They might have a very redundant or extra skin in the breast. The breast might go down and descend toward their stomach. And also for the arms, some of them, they will have this excess skin hanging outside their arms. The same thing applies to the stomach and the back. Men complain that they have this skin in the stomach that hangs over their private areas, and when they wear their jeans, it goes around the back as well. Women, the same thing. Also, they complain of loss of fat in the back too, as well. The same thing applies to the thighs. There's going to be excess skin in some patients, and that's mostly located inside the thighs from inside. So the assessment has to be complete from tip to toe. Every specific area has to be addressed with a specific theme of management.
Okay. I think that's true, because there is a common English quote that one doctor makes a job for another. I think bariatric surgery making up.
Well, I think that's true in this situation, yes, to some extent, and that helps helping the patient at the end.
Great, okay. So how safe is liposuction, or what are the types or variants of,
Well,
lipid removal?
Okay, so liposuction is fat removal.
Excellent.
Okay. Now, one of the most important thing people should know about liposuction, that liposuction is not for treatment of obesity.
Oh, that's important. Okay.
Liposuction is a procedure that aims toward getting rid of specific deformity caused by fat, which means that the patient should have a normal weight, but there's some fat located or accumulated in an area that led to deformity, or abnormal shape. That's number one. Now, liposuction is a simple procedure, and it's supposed to be safe if it's done by a qualified surgeon under strict and sterile circumstances in the OR. Now, you probably heard many stories about patients who underwent plastic surgery here in our city, in which some of them ended up with significant disasters. And when we dig a little bit in these cases, some of them are not even done by surgeons. Or they were done by surgeons who are not qualified. So the most important thing for patients to know is, number one, if you go into a plastic surgeon, just make sure you actually go to a real plastic surgeon. Make sure that you check their qualification, and make sure you get the right procedure done. You're right. You have the right to see more than one plastic surgeon and see different opinions, and then choose what you think is the best for you. So I think that's
that's important. So again, we can elaborate more about modalities of and alternatives of liposuction.
Now, liposuction, when it started by just passing a tube attached to a suction machine. The tube goes under the skin to the fat pockets, and then it sucks the fat out. Now, over time, technology has evolved. Now, one of the most common technology used is using the ultrasonic technology, in which first an ultrasonic device is introduced under the skin to the fat pockets, and then that ultrasonic device dissolves the fat by heat. So the fat will become almost like an oil. And then that device is removed, and then the same suction device, the one that was used for liposuction, is used to suck that fat out.
Liquefaction.
Yes, by liquefaction. Now that's the using ultrasound. Now liquefaction of the fat could be done by ultrasound, could be done by laser, it could be done by radio frequency. And there are many different technologies now emerging, but those are the main three technologies that are used in liposuction. Now each one of them is thought to have certain advantages and disadvantages. Now at the end, it seems that liposuction, the traditional liposuction, is still keeping its ground. It's still the most commonly performed procedure in liposuction.
Interesting indeed. What are the commonest misconceptions about liposuction? Because I have seen myself many patients obese, they want to just do liposuction to get rid of obesity.
Well, that's one of the most. I think this is the most common misconception. People think liposuction is a cure for obesity, or it's actually a method of treatment for obesity, which is not true. Some people will think that liposuction will help you to lose weight. They think, okay, let me go and drop 2 or 3 kilograms of fat by having liposuction. This is also wrong. I think this should be avoided, because if liposuction is done for the right indication, in many cases they actually don't lose much of weight because fat is very light. So if you even remove a good amount of fat, there wouldn't be the expected amount of weight loss in those patients. So I think these are the 2 most common misconceptions. Also, some patients will ask for removing all the fat from their stomach, which is not normal or not healthy. It will not give you the normal looking stomach, because your skin will be stuck to your muscles. I'm talking about women and men too. And some of them, after doing the procedure, they will go back to their bad habits, and they'll start gaining more weight, and that actually will reverse the effect of the procedure in the long term. Patients will not be happy with the cosmetic outcome.
Excellent, excellent. Now we'll go for a short report and we'll be back. Please stay tuned. Welcome back, our dear viewers, to Elixir of Life, and our episode theme is obesity and plastic surgery. Welcome, Dr. Ghazi AlThubaiti, and now we are getting to the topic and getting deeper. What are the most common cosmetic complications following liposuction?
Well, if liposuction is like any other procedure. There's expected percentage of complication. Let's say like 5% or so. And those complications are not specific to liposuction in general. They could include infection, bleeding, accumulation of blood, or infected fluids. Now, this is not specific. It could come with any procedure. Now, talking about liposuction as a cosmetic procedure, there are certain complications from a patient perspective, which is the deformities not having the outcome, the patient not having the outcome he was expecting or she was expecting, having one side different than the other side. Asymmetry. These are possible. These happen often, but they're not considered complications because most of people, they have abnormal, they don't have perfect symmetry. I mean, the right side is not exactly like the left side. Now, other complications that happens with other cosmetic procedures, such as tummy tuck, breast lift procedure, thigh and arm lift, are a little bit different. Some of them, they have a wound, a long wound after surgery, and that wound is prone to develop complications. Now, the chance of having complication is not high. It's still maybe 5% or less, but it can get higher if the patient has certain medical conditions, condition that actually affect the healing, or they could be smokers. Smokers tend to develop delayed wound healing and skin edge healing problems. These are also potential problems. Also, there's the potential complications that could come with anesthesia, which are minimum.
General anesthesia, okay?
Yeah.
So done under general anesthesia, not under local, this procedure.
No, it can be done under local and it can be done under general anesthesia. Now, depending on the extent of liposuction you want to do, it could be done in an office procedure, like liposuction is done, the patient go home the same day, or they could have to stay in the hospital, depending on the amount of liposuction. If the surgeon did 5 liters liposuction, then it's advisable that the patient actually stays in the hospital under supervision and given IV fluids, intravenous fluids overnight, just to make sure that they're okay, they don't lose too much fluids.
Dehydration, okay?
Yeah, dehydration.
Excellent. So is it true that plastic surgeon should be artist? So because it's an art, okay, you have to check the, I mean that's...
Well, what I agree with more is not being artist. I agree more with being well trained.
In addition to training, I'm saying.
Well,
okay.
yeah, that's a bonus. If you're an artist and you're a plastic surgeon, then that's a bonus. But I think the most important thing is not being an artist. The most important thing is actually being well trained, responsible plastic surgeon, and that's the problem. That happens. Every now and then, we see patients who come with massive complication following liposuction that was done by a surgeon who's not even qualified. And some of them that actually led to patient death.
Okay, good.
Yeah. So that's the serious thing. I will always ask my patients, you know, if you want to go to see a plastic surgeon, then the first thing you should ask is check what's their qualification, check their Saudi license.
Is that right? Is the right of the patient, okay?
Exactly. You have to know what's their qualification. You have to check the Saudi license card. You have the right to see it. And it should state that he's a consultant plastic surgeon, not a consultant surgeon, because that's not specific.
Not general surgery,
that's not
plastic.
specific enough. You have to meet a plastic surgeon. And the second thing is there are so many surgeons who are advertising for different boards, you know, and different types of qualification, which is a problem sometimes. You don't know who's really qualified and who's not. Then one of the methods is you check the history of the surgeon. If the surgeon actually worked in a government hospital as a consultant before, then probably they were screened before, and their qualification was screened. If they only entirely worked their life through the private sector, then probably they were not screened in the government hospital. You're not sure about their qualification. I'm not saying that those are not qualified, but I'm saying You have the right to check, and you have to know how to check.
Sure, excellent. So you mentioned there are some complications, cosmetic complications of liposuction and deformities. How you treat these deformities? Okay.
Well, it depends on the. Talking about the deformities after
Yes.
having a cosmetic surgery, these happen, and the surgeon has to address the deformity. What kind of deformity? Sometimes after liposuction, the surgeon who did the liposuction may have sucked too much
Dimpling you.
and ended up with a dimple, or sucked too little that ended up with a fullness. So that's easy to address. They just go and correct the area either by suctioning the area that has fullness, or fat injection in the area that's dimpled, and that could be fixed. The plastic surgeon could assess the area one by one and will come up with the solution.
So what are the commonest types of procedures in addition to liposuction after bariatric surgery?
Well, liposuction is not really the most common type after bariatric surgery.
Okay, what's
the liposuction is removing fat. Let's say there's other type of procedure called excisional procedure, in which the skin is removed, tightened.
Okay.
That's the most common type of procedure after liposuction, after bariatric surgery, because what happens is they lose their weight and the skin becomes redundant around the body. The entire body becomes redundant skin, and that skin needs to be excised and tightened around the body. So that's the most common procedure done in patients who are post-massive weight loss. Liposuction is used as an adjunctive procedure to help this, to give you a better outcome.
Excellent. I mean, these, procedures can be done in one stage, or should be done in stage, fashion?
This is a very good question, because I get asked this question very often. I wouldn't advise doing all of these procedures together, because they tend to be big procedures, and the longer the procedure, the longer the OR time, the higher the complication, the higher the chance of bleeding, the higher the chance of needing blood transfusion. So we typically divide the procedures into addressing the lower part of the body first.
Sure.
And then once that's fixed, several weeks later, maybe several months later, addressing the upper part of the body. And then at the end, we'll look at the thighs and address them at the end. Now, doing all of these together is too much for the patient. I mean, too much to tolerate, and the chance of complication is much higher.
Excellent. What about plastic surgery done outside hospital setting, like home or a beauty shop? And you answer this important question, and would like to take your take-home message.
This is a problem. I think it's a national problem here in Saudi Arabia, in which many ladies will go to a beautician, not even a physician, and who will inject a permanent filler in their faces and other parts of the body, and then at the beginning the result will look amazing and cheap, and then over time they will realize that they start to develop deformities and infections, and some of them they actually end up with a severe infection, a recurrent infection that keeps coming every several weeks or even several days, and the patient will end up in the ER on a routine basis. I've seen few cases, and the result was disaster. It actually led to major burden on the patient, her family, and it's very hard to remove these foreign material from the body after they get injected. So I think doing these in home is actually
disastrous.
It's a crime. I think the government is actually taking action against those. This is a crime. If you don't have a medical license, you should not do it. So there are a few patients that we keep seeing every now and then. Now it's much less than it used to be, but it's still there.
Excellent. I think this is maybe the take-home message of our, interesting interview. And I would like to thank you, Dr. Ghazi, for enlightening us about this important topic, and hopefully to see you in the next episodes.
Thank you very much. Thank you very much. I would like to thank your crew here for their hospitality, and I wish you all the best.
Okay, thank you, Dr. Ghazi.
Thank you.